Hi, and welcome to Askimo TV. I'm talking today to Dr. Vel Sakthivel. Dr. Sakthivel is the lead doctor for the Department of Children's Orthopedics at the University Hospital Southampton in the UK. He specializes in children's orthopedics and sports injuries around the knee. Hi, Dr. Sakthivel. How are you?
Hi, Joanne. I'm fine. Thank you. Thank you. How are you?
Very well, thank you. Dr. Sakthivel, let's talk today about knee arthritis. What is knee arthritis?
The arthritis essentially means inflammation or breakdown of the articular cartilage, which is a medical term for the shiny surface of the knee joint. It can be caused by many things. The most common diagnosis the viewers would have heard is osteoarthritis. It's essentially wear and tear of the articular cartilage. So there's a bit of breakdown of the articular cartilage. And the other forms of arthritis are inflammatory arthritis, where you have some things like rheumatoid arthritis. And there are some times when you can have infection in the knee for some reason, and that could start affecting your articular cartilage, the shiny surface of the joint. And that is called septic arthritis, because it's infection. So the word arthritis means is a breakdown of your shiny surface of your joint. It can be due to many reasons.
Who is at risk of getting arthritis?
Okay, literally anyone can get arthritis. Usually we tend to see the osteoarthritis in the slightly older patient, and I say usually, I've seen in younger ones as well. If infection in the joint can really literally affect anybody. Rheumatoid arthritis, the younger patients, but there's lots of other reasons for it. We send them off to the rheumatologist to identify various reasons and various types of inflammatory arthritis. And then there is the other group of patients who have fallen down and hurt their knees, for example, or been involved in an accident or something like that, where you have a fracture which extends into the joint. Now that can cause arthritis, not straight away, but later on, because the articular cartilage, the shiny surface, can be bruised and can be broken down from the traumatic event.
How is knee arthritis diagnosed, and what treatment options are available?
It is diagnosed by history, which is what we start talking to the patient about. So when you get pain, how long have you had the pain for? Have you had an infection, some time ago? Have you had an injury where you had a complex fracture or something some time ago? And those sort of things we ask them. In terms of, after the history, in terms of investigating it or diagnosing it, clinical examination is the next step, where we move the knee around, examine the knee, move the kneecap around to see where the pain is, and what sort of movements bring out the pain. Because sometimes people can walk on straight ground or plain ground, okay, but they can't climb up and down stairs. That can cause more pain. But this will give us an inkling as to where the arthritis is in the knee, for example. And the definitive investigation is an X-ray. We do an X-ray, and that tells us where the arthritis is, where the joint surface is sort of broken down, and things like that. Occasionally, we will have to do something like keyhole surgery, for example, check inside, do a little bit of treatment where we smoothen the broken down cartilages, but also identify how extensive the arthritis is and what sort of parts of the knee it's affecting, because it will give us a plan to provide to the patient as to what their treatment options could be.
At what point or what signs would there be that you would need a knee replacement?
Knee replacement, as I told you in my interview with regards to knee replacement stuff, is mainly for pain, and I probably would repeat it again. In my experience, it's done purely for pain. This is pain in arthritis. The reason for pain is the joint, the articular cartilage, has got no nerve supply. It's like your hair and nails. Now, if you cut your hair, you don't really feel the pain. So when you thud on your cartilage, so you're walking along, you're jumping up and down, you're pressing hard on the cartilage inside your knee. Now, that doesn't hurt you because they've got no nerve supply. However, once the cartilage or cartilage goes through a process where it's breaking down, it's sort of, getting worn out, what happens is it exposes the underlying bone. Now, that part is extremely sensitive. It's got loads of nerve supply. It's exactly like cutting your nails too short. Now, you can understand how that's going to be. And our aim is to cover that underlying bone. And essentially, the replacement operation is that. So it takes out all the worn out parts of the cartilage. It takes out all the cartilage, really, and puts a metal end to the thigh bone. So the metal end protects the end of the thigh bone, top of the shin bone, and thereby protecting all the exposed parts of the bone, which has got lots of nerves. So that is the essence of the replacement operation.
Thank you, Dr. Sakthivel. Thank you so much for talking to me today.
Thank you.